Many patients come into my clinic and they say, I just feel like a piece of me goes to one office, a piece of me goes to another office. Like, I don't want to be seen as pieces of a whole person. I want to be seen as the whole person and know what to do and feel like I have all my answers in one place.
That's Lindsey Causey with Cone Health, discussing the importance of whole person care in oncology. We'll hear more from her up next. Welcome back to the award-winning Cancer Buzz. I'm your host, Summer Johnson. This is the second episode in a series examining the findings of the Trending Now in Cancer Care report. The report is developed from real-world oncology challenges collected during interactive sessions at the ACCC 51st Annual Meeting, also known as AMCCBS. Lindsey Causey is a nurse practitioner at Cone Health Cancer Center in North Carolina. She helped put together the meeting where she facilitated a deep dive session on comprehensive cancer care. This was top of mind for many, with the big question being how to implement new programs like whole person care into cancer centers.
So, for instance, there are certain things that may need to be in place before being able to proceed with some of these wonderful programs, such as, do we have a system in place to evaluate social determinants of health at diagnosis and through critical care junctures? The other is, how often are we doing distress screening? Do we have criteria, have the oncologists and oncology advanced practice providers, have they all aligned on criteria for early referral to palliative care or a partnership with palliative care?
She says that's where the Trends report comes in handy. Teams can rely on it to learn how to put research into practice.
It really allows you to reflect on what the current state is first, and then understand what might need to happen to be able to bring some of these things to fruition.
Causey said some of her major takeaways from Part 2 of the report included the feature by Dr. Mariusz Verga on his Living Well program.
What was really profound in Dr. Verga's article and recap of the discussion was his call to action to stop treating mental illness as an afterthought and start treating it as essential to survival. And I couldn't agree more with this statement, because mental illness, it impacts cancer treatment and the patient's ability to adhere to treatment, but also it can impact different junctures that patients are at. So if we have a patient that's going from chemo to radiation, it can cause delays there. Sometimes it can cause delays in getting patients reconnected back with primary care, especially in cancer survivorship when we're seeing increased fear of recurrence and uncertainty about next steps in the future. And so really ensuring that we're having screening to detect anxiety, depression during these critical junctures is essential.
Causey went on to talk about the work of Anne Marie Rainey, the Director of Value-Based Care at the American Oncology Network, who supports whole person navigation.
That navigation, it really allows for timely access. It can improve patient adherence and decrease any disparities in care. And Anne-Marie's work really allowed a model that people can follow to understand how to bill or code and bill and get funding. And that's really essential to be able to provide those services, especially, in today's financial climate in healthcare.
Her final takeaway was the value of early palliative care.
Early palliative care is essential, not just because it helps with patients and improving their symptoms, well-being. It also increases their survival, but it can also help reduce provider burnout by partnering with palliative care, because there our patients are having complex symptoms that can sometimes be difficult to understand and manage. And partnering with palliative care allows us to give that to someone who is an expert in that type of management.
Causey emphasized the importance of peer-to-peer discussion, as she's been able to do through ACCC.
The value that I've seen with the ACCC membership is it's not just the what, it's the how to operationalize and move things forward to provide patient-centered care in the best way possible, but that's also not really burning out providers in the process.
Thank you to our guests today. You can read part 2 of the Trending Now in Cancer Care report for yourself. There's a link right to it in the show notes. And if you haven't had the chance to take a listen to the first episode in this series, there will be a link to that as well. It discusses part 1 of the report that focused on how cancer centers are navigating tech enablement, AI and BI solutions, growth opportunities, and strategic partnerships. Until next time, for the Cancer Buzz team, this is Summer Johnson.